Kristen, I know you said you lost your job, your nursing license got suspended, and then as soon as you got back onto your feet, I read in your book that there was this moment where you realized you couldn't even work for any federally funded healthcare program where you just got a job. What was your experience with the nursing board and both losing your license as well as recovering it again?
Well, yeah, losing my license after, all of that happened was devastating. Um, as I said before, nursing is the only thing I ever wanted to do. And I really thought that was gone forever. And so I was just going to go the rest of my life not being a nurse and really having no idea what I was going to do instead. I did end up getting a job at a doctor's office as a medical assistant and was going to a wonderful therapist in 2007. So I lost all of that in 2004. In 2007, I had been sober for just over 2 years at that point. And my therapist asked me what I thought about calling the nursing board to see about getting my license back. And I just kind of laughed at her. I thought, they're not going to give me my license back. Are you crazy? Why would they do that? With all the stuff that I did, they wouldn't. And she was such a wonderful therapist. She said, "Well, do you know that? Have you asked them?" And I said, "Well, no." I couldn't imagine calling the nursing board and saying, "Hi, this is Kristen. Would you give me my license?" Like I couldn't even fathom that. But she was just so encouraging and patient and kind. And she said, "I think you maybe should do that. Maybe you could just call them." Like she suggested it, kind of like you said, April. It wasn't a you should or you will, it was a suggestion. Maybe you should. So after some encouragement, I did call the board and they weren't interested in, shunning me from nursing forever. They just wanted to make sure that I was safe to practice. And so the nice lady on the phone said, yes, of course, you can join a monitoring program. And in Wisconsin, it's a 5-year, pretty intense program. And the Board of Nursing will monitor you as you're working to make sure that you are practicing safely. And so I applied to be in the program. I got into the program. And when I received that letter in the mail reinstating my nursing license, granted with a fair amount of limitations and restrictions, I was just overjoyed that I could be a nurse again. I can't even tell you how wonderful that was. The program was hard. And as you mentioned, about a year later, I found out that because of my drug felony, I could no longer work with any federally funded program. So, no Medicare, no Medicaid, nothing, which is all hospitals and clinics, like it's the vast majority of healthcare. So, I was out of work for a little while, but I did find a research company that didn't use any federal funds, and I got a job there as a nurse and really have been nursing ever since. I graduated from that program. I have my full licensure back today. So pleased about that. Like I said, I really thought that part of my life was gone. So the fact that I get to do it, I feel like I get to do it. And it's I'm just very grateful for that. But it was hard. The program was hard. Uh, right now, if you look at my nursing license, everything that I went through, and this has been now starting 20 years ago, everything that I went through is public record. So if you look at my nursing license, you can see everything. Everybody can. All you have to do is have, internet access, and I that will be the case until the day I die. It will always be there, and I struggle with that a little bit. I'm not saying I don't want anyone to know, but I think it would be nice if after a period of time, I don't know what period of time, but could we maybe say, yes, you are forgiven. We're going to remove this. It'll still be accessible to the Board of Nursing, of course, in case something comes up in the future, but could we remove that from public view? So that's maybe my biggest complaint about that. The other complaint I have is that there really isn't any support as nurses go through that program. At least there wasn't back when I did the program. There were about 300 other nurses in the program that I didn't know about. I thought I was like one of a few awful, terrible people who had done this terrible thing. But there were about 300 other nurses going through similar circumstances, but we had no way to connect with each other. In some of the work I do today, I learned that other states, like Minnesota, like New York, Colorado, have peer support programs or support for nurses as they go through those programs, which I think is really important. And so we started one with Marie Manthy's help and April and other folks in New York and Minnesota. We started with Spanner, Wisconsin Peer Lines for Nurses to be that support for nurses as they go through that program. We've expanded to other things now too, but nurses today have the support that I would have really liked back in the day. Like they have that now, and I think that's really important. But we are one of few states that have it, and I think that's something we need to work on, and we are actually working on that. But really important to support nurses as they're transitioning, because that is a huge, overwhelming time to lose your license and then be put in this monitoring program and then return to nursing, and you're supposed to do all that without support. Just seems a little bit counterproductive.
Yeah, I'm struck by what you said earlier. I think when we were speaking about who you are is more than just the job you do. I mean, April, you said you're more than just being a nurse, but I also hear Kristen, you saying you're more than just what you went through, than your substance use problem. And it's hard if that's the thing that's front and center everywhere all the time. April, you've often said, or I think in your work you've wrote that addiction is not recognized as a disease, but as a moral failure dealt with by punishment. And in your opinion, how does that approach really hinder people coming forward, getting the help, those 300,000 nurses that Kristen mentioned? How's that stopping them maybe from getting the help and support they need?
Yeah, it's like I mentioned when I first opened up and shared my initial story is I was just devastated to have this secret. And if my secret got out, my life and my license would be destroyed and I wouldn't be able to be a nurse anymore or have a life that I've worked so hard to have. Nurses don't just sign up to be a nurse. We work really hard for it and we study very hard and we have to hold a lot of information, a lot of skill and a lot of knowledge behind that license of ours. And when it's threatened to be taken away because you are having this what you think or what I thought was a moral failure, that's a pretty scary position to be in. It took me a very long time in my recovery to find out that this is actually not a moral failure, that this is actually a very complex disease process. And it does not define me. I'm April with a complex disease process, and it really I think we're making headway in helping the public see this and helping the nursing profession see this. We are not there yet, but we're making strides. And an example I'd like to share is we have a global recovery community online called In the Rooms, and we're going to talk a little bit more about that a little later. But I am one of the conveners that convene these meetings every Tuesday. And we started with 3 nurses, and we have an average census on Tuesday evenings out now of 100 nurses around the world. That to me tells me we're cutting through shame and stigma. The more we show up and the more we talk about it, and the opportunity that we have today to talk with you about this is another approach at cutting through shame and stigma. Another example that I have where I feel like we have to talk a lot more about is in the curriculum in nursing schools right out of the bat. We've talked about that. We can talk a little bit more about that. But it's really in the workplace, wherever that is. If it's in the ICU where I worked the majority of my bedside nursing, or if it's in a clinic or where a long-term care facility, rehab, I don't care where it is. There has been a culture that I have seen where nurses are giving report to another nurse and making subjective comments and judgments about a patient that is in being cared for with a substance use disorder. What are we saying about them as we give report and handoff? What is our attitude towards them? Are we being critical of them and judgmental of them? And are we handing it over like, oh, there's April again. I can't believe this drunk is in with another bout of withdrawal. And it's, just really negative and shameful things that nurses have said that I've heard and been a part of? Or are we showing up with compassion and understanding? And are we being supportive and creating a plan of care for these patients that is about support without the shame and the stigma? So we have so much opportunity to address this head on. And like I said, I think we're making progress, but we have a long way to go.
Thank you. Kristen, I want to fill in the gaps. I think because you shared about spending time in prison, then recovering your license, but what was that, what really supported you in recovering your life and your profession? If you want to tell us a little bit more about that, just so we have the full story.
Yeah, absolutely. Yeah, jail for me was the thing that took me out of my life for a little bit so my brain could clear. I don't, again, I didn't like it, and I don't advocate for sending nurses to jail. Oh, but if I want to look at the positive things, it did take me out of all of that, removed my access to alcohol and drugs for 4 months, just shy of that, a few days shy of 4 months, which allowed my mind to clear. Being in a miserable situation put perspective on where I was in my life and where I wanted to be. I knew that I did not want to be there ever, ever again. I did not want to feel the way I felt towards the end of my using. As I sat in jail, those first few days in particular were just awful. I never wanted to be there again. When I was released from jail, I say I threw myself into recovery because that's what I did. I had some experience with 12-step meetings, as April mentioned, that's her thing too. I had some experience with that. I had tried it. So I knew that it was a place that I could go. So I went to meetings every day. I got myself a sponsor and I worked those steps as if my life depended on it, because my life depended on it, and the lives of my children and my family. Like, we all, struggled and were hurt by the stuff I went through, and just really committed to doing everything I could to be sober. I went to therapy, which I told you I had tried before, but I really was not engaged. I could not open up. Jail gave me that ability. Like, I was so open. Like, I just had decided I was done fighting. I wasn't going to fight anything. I was going to be completely honest to the best of my ability and go from there. And so when I met with my counselor, we talked, and we really talked. When I went to therapy groups, I told a whole group of people, which was completely foreign to me, how I was feeling. I cried in front of people, which was, I still don't like doing that, but it was completely foreign to me. So I did all of those things with my full heart, like every bit of me, and it made a difference. I began to feel stronger. I began to feel, as April said, I began to feel like I'm not shameful. I did some really crummy things, and I acknowledge that. I'm not suggesting that any of that was good. But I, aside from those things, am a person worthy of love and support and recovery. And so from that, really from that day of getting out of jail on, I did everything I could, everything people suggested. I stopped listening to myself, and I listened to people I trusted, and continue to do that today. I still go to 12-step meetings, and I go to my peer support meetings now, and it's the focus of my day to day is making sure that I'm okay. And so my whole focus is different and changed and better.
I feel like I'm almost hearing what you said in the beginning, as where you said caring and helping others is just part of who you are, but there was this switch that happened where you realized you are as worthy of that care and helping as well, and that gave you that desire to get the help, and believe that you're worth getting it, which I think is such a beautiful shift in that unique quality within you as well.